This is Dr. Karen Goldschmidt. I'm here to give you a brief overview of systems thinking, and then we're going to have you apply it to medication reconciliation. Systems thinking is probably something that you do every day, but just don't think about. It's a process applied to individuals, teams, and organizations to impact cause and effect, where solutions to complex problems are accomplished through collaborative effort, according to personal ability with respect to improving components and the greater whole. In other words, systems thinking is a way of helping you to view systems from a broad perspective that includes seeing overall structures, patterns, and cycles in systems rather than seeing only specific events in the system. Nurses work in complex healthcare systems. Looking at systems from a broad view can help you to quickly identify the real causes of issues in your organization and know just where to work to address them. Systems thinking has produced a variety of principles and tools for analyzing and changing systems. Systems thinking involves that nurses view problems as occurring as part of a chain of events of a larger system, rather than as an independent event. For example, did a medication error just occur because of you delivering that medication, or was it a part of a chain of events of a larger system? System thinking also involves that nurses deliver nursing care understanding and valuing how components of a complex healthcare system influence care of an individual patient, and that nurses are aware that there are interdependencies in people, processes, and services. One way nurses can learn systems thinking is by creating flowcharts or process diagrams that elicit the steps of a care process and the multitude of healthcare workers involved in a process. This is similar to the mapping techniques of a quality improvement project. Looking at a med error is a way that you can use to map where the process or where the system failed or where the breakdowns in the systems failed. If you map that out, you can start to look at how you can reduce medication errors in your unit or your organization. Systems thinking is something that is not new. It's been around for a long time, and it's something that's valuable to nursing practice. In response to calls for improved quality and safety, leaders from schools of nursing across the country created the Quality and Safety Education for Nurses, or the QSIN initiative. This initiative focuses on the knowledge, skills, and attributes of patient-centered care, teamwork, and collaboration, evidence-based practice, safety, quality improvement, and informatics. This diagram from Delansky and Moore illustrates how the 6 QSIN domains are linked to optimal patient care through both individual care and systems of care. Traditionally, nurses have focused primarily on the individual care that they provide and paid less attention to assisting nurses to provide systems of care. Delansky and Moore proposed that in addition to the emphasis on teaching critical thinking skills, nurses also need to be taught the knowledge and skills associated with systems thinking. In their day-to-day work, nurses' abilities to engage in better problem solving, priority setting, delegation, interactions, and collaboration with other healthcare members, and decision making and action taking are greatly influenced by their ability to view how one component of the work system is related to other components and to the whole. Systems thinking can be viewed on a continuum, ranging from the individual nurse to the larger internal and external environmental components. Nurses' ability to systems think is essential for provision of safe, high-quality care. This figure shows examples of care approaches that represent increased levels of systems thinking. On the left, when a nurse is thinking from individual personal care effort, You can see that the nurse is thinking about how they will work as an individual, what they will do to initiate care for their patient. To a higher systems level thinking is how they will work towards prevention of pressure ulcers on their unit, how they will work to look at the whole, not just their individual care. This diagram, produced by Delansky and Moore, illustrates systems thinking on a continuum where it is expressed by nursing care as increasing ability to move from a reliance on authority to interprofessional collaboration, from high personal effort to ease of action, and from low awareness of interdependence to heightened awareness. One example here that I'll point out is teamwork and collaboration. So moving from a personal effort of individual care, the nurse ensures that her patient is ready for discharge by making sure that she has her prescriptions or the patient's prescriptions. Moving all the way towards thinking about the system of care for the patient, the nurse begins to participate in improving the discharge process through team meetings to structure communication during a patient's hospital stay. So you can see as the nurse is moving along, they're making discharge plans, they're starting to solicit input from other team members, and realizing that it's just not about their individual care, but it's getting everybody on the same page and the healthcare team on the same page and looking at the entire system of delivering that discharge care. It's important that nurses take a step back and examine systems and the interdependency among the parts when using systems thinking in practice. This will lead to a broader understanding of the healthcare system and the quality of care that results from the system. An example of this is when teams perform a root cause analysis, or an RCA, to understand the system factors that may have contributed to errors. Healthcare organizations routinely perform root cause analysis after an event so that appropriate changes can be made in the system to prevent future errors. Well, how great would this be to perform a system analysis when the nurse identifies that a system is not working or a new system is about to be implemented? This is an example below of a fishbone diagram. We look at the causes and the effect that happen from a system failure in a root cause analysis. We look at the processes, the people, the materials, and the equipment, and we go further and further into all the potential causes that cause the problem. We're looking at it from a systems thinking perspective. Systems thinking can be taught and learned, and an individual's level of systems thinking can be changed over time. Systems thinking helps nurses to see how to change systems more effectively and to be proactive rather than reactive. Systems thinking has the potential to prevent errors in practice, improve delegation, priority setting, and enhance problem solving and quality improvement initiatives. The systems thinking scale that was developed by Delansky and Moore is a valid and reliable instrument that measures healthcare professional systems thinking specifically related to system interdependencies. When nurses shift to systems thinking, they will be able to change systems more effectively. They act more in tune with the larger processes within the organization. They have the potential to prevent errors in practice. They will improve at delegation and priority setting, enhance problem solving and quality improvement initiatives, and will be able to lead in a complex healthcare system. Systems thinking has 4 primary attributes. Systems are dynamic. Here, the nurse considers the cause and effect of what is occurring. The nurse understands that systems are constantly changing and has to go back and reevaluate if the system is still working or if it needs to be changed. Nurses understand that systems are holistic and need to view systems from a holistic perspective. The nurse thinks of the problem at hand as a series of interconnected issues. The nurse keeps in mind that proposed changes can affect the whole system. So this may be familiar to you. If there's one change in a system of care, perhaps its implementation of electronic health record, it changes the system of care that you deliver to a patient. Pattern identification. The nurse seeks everyone's view on the situation, everyone's view on how patterns are emerging from their perspective is important to be able to view the system so that everyone can identify, this is what's happening on my end, this is what's happening on your end, so that we can make sure that the system is working, and if it's not, we can identify those areas where we can improve or we can change. And then there's transformation. The nurse includes people in his or her work unit to find a solution. It doesn't just come from one person. It has to be everyone working together. And the nurse can lead that. The nurse thinks more than one or two people are needed to have success. So understanding that just a couple people to make a change is not going to work. You can start with change there, but you're going to need to have buy-in from all stakeholders in the transformation process. What happens when there's no systems thinking? Perhaps you've been in an organization like that, where individuals lack the ability or capability for systems thinking. Systems are fragmented. There's a lack of holistic patient-centered care environment. It creates the possibility for consequences to patient safety. This is where harm happens. It creates an environment of care in which the patient is viewed as the passive recipient of care. And it creates further deficits in the whole system in terms of cost of care, financial burden, mortality and morbidity, and declining patient satisfaction. Perhaps you've been a patient in a healthcare system like this, and it can be pretty scary. So how do we promote systems thinking in practice? Organizations have to be committed to the embodiment of a philosophy of ethical practice and a non-punitive culture. Perhaps you've heard of the term just culture. That's non-punitive or non-blaming culture. It's really looking at the systems when something goes wrong to see what we can do to improve our systems. It's promoting systems thinking. We need to promote open communication among providers and between patients and providers, and provide healthcare providers with educational and self-development options to facilitate system thinking environments. Both novice and experts need to learn new ways of thinking and working together. Healthcare providers can provide education that begins to integrate systems thinking to promote interprofessional collaboration aimed at improving patient outcomes and system effectiveness. A recent example of this would be team steps. If you are involved in this in your organization or have the opportunity to be involved in a workshop, this is a very interdisciplinary, collaborative effort where the whole healthcare team can see each other's thinking through their own perspective and work together to build teams that are collaborative. In conclusion, as you move through the remainder of this learning module, we're going to work on the process or systems thinking of medication reconciliation. Take a step back and think about the medication reconciliation process. What is working in your healthcare system and what is not? What recommendations would you make or not to change the medication reconciliation process or system in your organization? Thank you.